So I've been in plastic surgery for the last 9 years. Actually 4 years for my master's training and then 5 years as a plastic surgeon and consultant until today. Initially, my thinking of plastic is just for aesthetic, something like just simple things. But when I joined the plastic, now I know it's like it's everything in this world, you know. It's not just simple, it's a very big area. So what inspired me is one, of course, my family, especially my husband, very supportive. And then all my colleagues, and I have a very good mentor. Not all the centre have plastic surgeon. For example, in Klang Valley only, the only centre that have plastic surgeon and plastic surgery expertise only in HKL, Sungai Buloh, and in University, UITM and UKM. And then you see in Southern, only in Johor and also Melaka. See, Seremban also don't have. So we just open new in Kuantan. With all that state, only one surgeon who has to cover the whole state. Yes, really, because I have been attend one of the conference in Singapore. It's about breast also. It's a breast campaign, something like that. It's a 27 years old who having a breast cancer. So when she underwent mastectomy and also reconstructive, feel like she had a new life. I mean, previous reconstructive surgery, she is very depressed with the disease. But after reconstructive surgery, she become more confident and she very happy because she have a new good breast as compared to the diseased breast before. The biggest case is when a patient has a cancer, for example, breast cancer. So surgeon will remove the breast, and then we as a plastic surgeon, we come and we reconstruct a new breast for the patient. So it's like a 3-in-1 surgery. It's not just shampoo 3-in-1, but we have 3-in-1 surgery where patient will remove breast cancer from the patient, and then we going to create a new breast for patient, and we take from the abdomen. It's become a tummy tuck. Okay, it's a couple quarrel, and then girlfriend sort of merajuk, and then she just cut her little finger. And then, of course, parents come to our hospital and we connect it back. It takes about 8 to 12 hours because it's very small vessel. We need to find it, do it under microscope, and then fine, alhamdulillah, okay. And then after 1 month, she come back with another cut. It's really triggering us. Why? And this story come. Actually, she having a boyfriend and then quarrel and then make this silly, I mean not silly, like it's not a very wise decision to cut it, to make it, it's a really cinta sejati or something like that. We don't want to put it back. Why? Because she may come back and it's not just a simple surgery. It takes us hours. And it's become double trauma, right? The vessel that we gonna anastomose, it's not healed yet, and we need to put another, repair. We cannot do that. We can, but we don't want this kind of patient. So we tackle in different way. We refer to the counselor and also psychiatrist. We do have case like wife cut his husband penis, something like that. So patient come to us. The best moment, we call it 6 golden hours. If possible, if we want to reconnect, it must be within that hours because the vessel is still okay, still not thrombosed, not blood clot inside the vessel, and then we can try our best to find a vessel and connect back. But we need to educate public how to take care of the distal part. So you need to make it into, we have cold ischemic time and also warm ischemic time. So the best is cold because it's like preserve that things before it's cannot use. Just put it in a wet tissue or wet cloth and then wrap it and put in ice box and then bring to the hospital. We not judge. We not judge case by case, regardless what the history behind that. But we try our best to salvage it. We should always think in a positive side. Not all the patients who coming for tummy tuck or facelift is because of unnecessary. Sometimes we need to help patient. Sometimes that's a main problem for them. That's why they seek for help. I understand sometimes it's unnecessary, but we need to tackle what her or his concern. Sometimes patient who working in a media massa or something like promoter, she need to be presentable to the public so that she can perform well. For example, I have patient who really cannot smile, and patient come to me, "Doctor, can you make me smile?" Sometimes I just want to laugh with that kind of question, but we cannot. As an expert, we need to take it positively and try to tackle what's the problem. So I discussed with her. For smile, we have 4 types of muscle. 4 types of smile. We have a lot of type of smile. So maybe because of that muscle not less practice, so that she had a problem to smile. So we just discuss in further what you want and what's actually the problem. When after 1 hour discussion, we have expert in this area, and patient can be walk out from your clinic satisfied without doing surgery. And sometimes in the sibling, all the siblings very beautiful. She's the only one who don't have dimple. We can create for her, no problem. We can create as a plastic. We have knowledge and we can do that. But I need to get more for further detail. Why you want to do this? When we go into detail, then I know because her sibling have that dimple and she also want. So I think I just consult her. I can do for you, but if let's say you don't have, is it going to be a problem for you? If really patient want to do, then I have no say because I already consult. So for that patient, if let's say because of that dimple it become depressed, I need to do. The best moment when patient come to my clinic with smile. Especially after we done an operation. Out of all the case that I do, I think when patient who having cleft lip and palate problem. When patient born with the cleft and palate, it's always become a depressed. It's depression, right? For parents, for relative, for siblings. For sister who having his brother with cleft. We as a plastic surgeon, we try and help to close the cleft, and then after 3, it's become our baby from the beginning of the born until patient get married, because we need to augment the nose. We try our best to make it as perfect as normal person. So just to make it complete management for patient to have a good and quality of life. I just want to highlight what is plastic. Actually, it's a Greek word. It's a Greek words. It's a plastikos. It's meant to mold. So we can mold everything in this world. Because of the term. So in our body, we can mold everything. We can create a new ear with our ribs. We can mold abdomen to the breast. We can make a nose from our forehead. We can create new vagina for men who want transgender, everything. We can create that. It's very unique, right? We can mold everything. But with that knowledge, for those who have that knowledge, having a very great responsibility to use that knowledge in a proper way. That's why I choose plastic as a main part of my career.